American doctor. However, while we spend significantly more money per capita on medical care in the United States than any place else in the world, we've got a problem. Out of 50 industrialized countries in the world, according to the Central Intelligence Agency, we rank 46th out of 50 in terms of the quality of health of our citizens. Something seriously wrong here. Physicians perform more than 400,000 bypass surgeries, and in spite of that, more than 2,000 people every day die of cardiovascular disease. The thing that really is, to me, a serious problem, the United States, while it only comprises 7% of the world population, we consume nearly 50% of the world's pharmaceutical drugs. How did we get into this mess? We are a society of convenience, of lack of movement, couch potatoes, working on the computer, stress to the nines. And if you look at all of the factors that are actually contributory to poor health, this is it. So what is alternative medicine? Waiting 45 minutes to 3 hours for a doctor that's going to see you for 5 to 10 minutes. The problem is primary physicians are not trained in integrative health. They're not trained in nutrition. One of the things that I've had the privilege to do is to lecture to the medical students at Rutgers Medical School. And I've asked, I said, let me ask, how much training in nutrition do you actually get here? And the answer is either you're it, and I'm there for an hour, or 2 hours one afternoon. So when you're asking a medical doctor a nutritional question, it's like asking your electrician to fix your toilet. The whole object of medical science today is let's suppress the symptom. Rather than let's treat the cause, let's cut off the reason why you're having the problem in the first place. And the only options that are normally available is a pharmacological or surgical intervention. What is naturopathic medicine? Everything that you've heard this morning and subsequent to my talk is really part of naturopathic medicine. Naturopathic medicine really is the umbrella that encompasses mind, body, and spirit. It's about what we eat. It's about how we move. It's about how we think. It's about our interaction with the divine, with our universe. That's what naturopathic medicine is. And we have an abundance all around us that's growing naturally that we have as resources to keep us well. Where's the validation? We don't have double-blind placebo studies. We have empirical research that has a 4,000-year history. No herbal company is going to spend $1 billion to research the efficacy of a product like echinacea, which we know works. You can't spend that kind of money on a natural product that anybody could make. The cost of a new drug development right now is about $900 million to get a new drug approved through the FDA. In order to make that money back, they are only researching drugs that you're going to have to be dependent on for the rest of your life. For example, research on antibiotic drugs is almost non-existent. you take an antibiotic for 3 to 7 days. Not enough money to substantiate the cost of research and development. We are in the information age. Patients that come to see me have a level of sophistication that you don't see in a medical doctor's office. People come to me informed. What are they using? Where are they getting their information? This is an article. I actually have an enlarged copy of this in my office. Who needs doctors? You may be better off without them. Medical doctors, not naturopathic doctors. And these covers are all over the place. There's something called iatrogenic causes, which means those casualties that are caused by doctors and hospitals. There were 2 references in the Journal of the American Medical Association, and it revealed that well over 100,000 people die each year as a result of pharmaceutical drugs taken as directed. Now let's think about that. If you knew that one jumbo jet carrying 300 individuals was going to go down once a year, like clockwork, would you think twice about getting into an airplane? How about if it was once a month? How about if it was once a week? How about every day of the year, one jumbo jet goes down? That's the equivalent of 106,000 documented deaths in a hospital setting. This is not even taken into consideration people who die at home because they took a pharmaceutical drug that ended their lives. Other individuals that have really made a difference in the way we think, and people and individuals and doctors and brilliant people before me that have made a difference in the way we practice naturopathic medicine, natural medicine. Dr. Andrew Weil. Of course, we all know Dr. Oz. I have a sign in my office. Please don't tell me about Dr. Oz, but I'm just kidding, actually. We love Dr. Oz. Now, this is information from the National Institutes of Health where they asked, what do patients want? They're looking for a cure. They want to use safe, natural products. And if they're going to be using a drug, they want to know that they're going to survive the drug therapy. If they're going to have surgery, they want to know that they've got a pretty good chance to survive the surgical intervention. They want to feel empowered. They want to be part of their wellness program. They want focus to be on their own emotions. They don't want to be a number. They want the 3 T's. They want to be treated as individuals. And of course, they want respect. What are some of the conditions that we look at as those individuals that can actually be helped through naturopathic care? And these are just lists of individuals that have come to my office that have had profound improvements in their condition. And being a naturopathic doctor, I specialize in family care. 12% of my practice are kids. I get a lot of conditions where it's emotional, anxiety, depression, autoimmunity, and I deal with a lot of cancer cases. I love this slide. And basically, the difference between naturopathic medicine and a medical practice could be really summarized with this simple metaphor. If you're driving down a highway and all of a sudden your check engine light comes on, you pull into this garage, fancy garage, that says M.D. garage. So he brings the car into the back, and he snips the wire to your check engine light. And then you walk, then you drive away, you're fine. There's no check engine light on. What this driver didn't notice, further down the road, recessed a little bit, not really a fancy garage. It said N.D. garage. Great mechanic. He's the mechanic, or she's the mechanic, that really tries to find out why did the check engine light come on in the first place. I don't specialize in gastroenterology or endocrinology, cardiology, oncology. I'm looking at how does this picture, how do all of these symptoms relate to what's going on with this particular patient. I want to look at all of the individual factors and connect the dots. Essentially, we definitely want to stop the leak. How do we change our perspectives on health? We have to be proactive. We cannot ignore symptoms that happen to be nagging us. You can't say, well, you know what, my father had this, my mother had this, and now it's my turn. But we really have to be attentive to what's going on with our own bodies. Get regular assessments. Stay focused on health and fitness goals. Look at where you want to go rather than move away from where you don't want to be. Because if you try to avoid or move away from what you don't want, you'll never get there. Pick a point, a health point, a goal that you want, and move in that direction. We have to remember that food is information. If we eat crap, we're going to feel like crap. Exercise is the best medicine. The law of attraction, affirmative thinking. And change the channel on stress and anxiety. And when I have people with anxiety that come to my office, and I get quite a few, I actually tell them that anxiety is like yelling at the television set because you don't like what's on. We all have a remote control. So it's easy with a television set. You don't like the program, you change the channel or turn the television off. Anxiety works the same way. The only difference is, and many of the speakers before me actually reiterated this, get into neutral, get into your mindful meditation, do your yoga, and then change the channel. Change your emotional channel. Change your thoughts, reduce your anxiety or eliminate it. I wrote an article called Aging is Inevitable, Losing Your Mind Isn't. So I changed the slide a little bit, saying aging is inevitable, chronic illness isn't. When we look at all of the chronic diseases, including cardiovascular disease, heart disease, cancer, stroke, arthritis, these are some of the most common and costly diseases that we as a society confront, and they are the most preventable. A couple of my favorite quotes: we cannot solve a problem with the same level of thinking that created the problem in the first place. The two wolves. I love this line, and I just got a signal that I've got to rush a little bit. But essentially, I love this slide in that they're talking about the traits of the good and bad wolf. Who wins? The one you feed. Now, I want to speak to you briefly about a patient of mine who came to see me about a year ago. His name is Chuck. And, yeah. Wow, Chuck is here. Come on up, Chuck. Okay.
Hi, everybody. My name is Chuck. Obviously, I didn't surprise him. He knew I was sitting out here, but I came up because I love to hear him speak, and I love everything that he talks about. And I love the opening speakers this morning. I'm right on the pulse of everything that you guys are saying. My name is Chuck. I'm not a medical doctor. I'm not a healthcare physician. I'm just a regular working business professional writer that basically in February of 2014 turned 50 years old, walked into Dr. Gero's office and said, I want to die. I have every single symptom that you could possibly think of that basically makes you want to kill yourself. I had a blood glucose reading daily of 340. I had an A1C reading greater than 13. Basically, if you know anything about that, I guess the normal human being is supposed to be in the low to mid fives. And it says on the side of the box, you know, if you're 7, go see a doctor. If you're 9, check yourself into a hospital. That's what I had. I had a blood pressure of 179 over 134. I was 180 plus pounds, somewhere around there. That was 16 months ago. I stand before you today. Once again, I'm not selling anything. I'm not writing a book. I stand before you today. My blood glucose reading this morning was 98, and that was not fasting. That was fasting, sorry. And my A1C, which was taken last week, was at around 5.6. I'm 149 pounds. Now, let me just give you a quick rundown because I know that we're very, very short on time. Tell you what kind of guy I am. My father died at 47 from a massive heart attack. I have 4 older siblings. 2 of them are dead from diabetes. My sister is dead. And my next brother, who is slightly older than me, shoots himself with insulin 4 times a day in the stomach, and he has a number of other issues. I am very much, me, Chuck, personally, I am a full-on, hit the button and go, 24/7 work, live life to the fullest, full-on guy. If you're looking for that type of person in your life, I mean, I'm your champion. You know, call me. I will do, if you tell me, hey, Chuck, let's start a business, I'm going to say, hell, let's start 3. Why wait? If you say to me, hey, let's go have lunch in London next Saturday, I'm going to say, Saturday? Let's go tonight. Right? Let's get going. Like, why are we waiting? Let's go, let's go, let's go, let's go, let's go. And I've lived 3 lifetimes before 50, and basically, I guess because I'm such a full-on guy and I'm very abusive to myself, if I'm going to get type 2 diabetes, I guess I'm going to get it really, really well. So I did a very good job, obviously. Went in, got my full blood tests, and basically what it took, and thinking about all the speakers and what you guys are saying and what Dr. Gero is saying, is really all it took was wrapping your mind around something. I told my wife back when I turned 50 and I first started feeling all the symptoms, name it, nerve pain, couldn't hold a pencil, erectile dysfunction, depression, all kinds of stuff that I shouldn't have, but I had. And I basically woke up and told my wife, listen, I'm going to, you know, I grew up here in the surf. I'm a beach guy, surfer guy. I'm going to drive to California. I'm going to hit every possible cool coffee shop on the way. I'm going to eat every possible cool piece of food I could eat. I'm going to hit the Pacific Ocean. I'm going to jump on a surfboard, and basically I'm going to paddle out till I can't paddle anymore and either drown or something eats me. But that's the way I want to go out. And I'm going out. And my wife, being who she is, basically was like, okay, listen, you know, you might want to think about this. Very calm, you know. And this is what I told Dr. Gero. And all Dr. Gero said to me was, listen, man, you know, look at me. I'm 68 years old. You just need to change your way of thinking and wrap your mind around something. He convinced me life is still good and that I wasn't going to get the pieces taken off like my brothers. I wasn't going to grow up and be debilitated when I was 55. He convinced me that with a little bit of effort, a little bit of strict diet, a lot of really exercise, very strict, that I could do a lot of cool things. But let me tell you, a year and a half later, I'm not on a diet anymore. I make choices. I don't go to exercise because I have to. I go because I choose to. I'm not sick anymore. I'm alive because I choose to be. And that's the main thing, that if you could tell your patients, tell yourself, tell everybody, choose it. It's not that hard. And I have to tell you, with what I did, I'm not looking for a pat on the back. It really was not that difficult once you wrap your mind around it and change your perspective. Anyway, thank you.